Breast augmentation is a procedure where you put an implant underneath the tissue in the breast to make a breast larger, a little bit more perky, and to add, just to add overall volume to the breast. Recovery time varies from patient to patient, but in general, the patient's able to go back to work within 3 to 5 days for light duty. Patients can generally start to exercise around 2 to 4 weeks with some light jogging maybe. And then after 4 to 6 weeks, they're able to go back to their regular workout routine. The ideal patient for breast augmentation is somebody that's wanting larger breasts, a patient that maybe had larger breasts during pregnancy or had larger breasts before they lost weight and want to go back to that, to their previous shape, or a patient that's just always desired larger breasts. Any surgery has risks. There are risks involved with breast augmentation as well. The most common complication with breast augmentation is asymmetry between the two breasts. If that occurs, then we can fix that with an additional procedure. Sometimes you'll have scar tissue form around the implant that can cause distortion in the breast, and if that occurs, then we can go in and correct that as well. The other risks are common with any procedure that's done: infection, bleeding, complications with anesthesia, although complications with anesthesia is much lower today than it was 20 years ago. But these are just some of the complications. Breast implants can last forever in some patients, but the average expectancy for the implant life is around 10 years before patients require either an implant exchange because an implant's ruptured or some sort of revision in the breast.